many blessings that you upon us. We ask that you guide us and give us wisdom, oh God, as we handle the affairs and the welfare of this county. In your name we pray, amen. Okay, I need a motion to adopt the agenda for tonight.
So moved.
I've got Steve, may I get a second?
Second.
Okay. All in favor, I'll call the list of people that are on the screen. Chris Bowe.
Aye.
Dr. Taylor.
Aye.
Dr. Hagler.
Aye.
Gentlemen in the room. And myself in favor. So thank you very much. Motion carries. All right. May I also have a motion to accept the minutes for the April 12th regular meeting?
Move to approve.
Okay, thank you. That was Steve. May I get a second? I'll second. That was Chris. Thank you very much. Excuse me, Chip. Everybody. All right. Again, I will call the roll as far as those that are on screen. Chris Bowe. All in favor?
Aye.
And Dr. Hagler?
Aye.
And Dr. Taylor?
Aye.
Gentlemen in the room? Thank you very much. Okay, motion carries. We will basically move to our reports and we'll start off with Sue.
Good evening, board members. We're going to start off with the 3 monthly financial reports that we share at our board meetings. So the first is our snapshot that shows the programs and how they're operating, so you can take a quick look. Dental health is still yellow. We're just monitoring that to see. We did lose one dentist, but we are recruiting for the replacement for that dentist. So we're continuing with that. And the next report is your analysis report. It compares this year to last year, and our two biggest items are the COVID response that we have, the additional funding and expenses related to our COVID response for our year-over-year analysis. And then our next report will show you we're continuing to anticipate how we will end the year. We are actively billing for all of our vaccines, and the reimbursement rate from the insurance companies has gone up, so we're getting more money in from the vaccines than we thought, and depending on how we finish this year out, use some of that money next year to continue our responses. Our Medicaid cost settlement, we have submitted that to the Department of Medicaid at the state level and waiting on their response, so I am hopeful in June that we'll have more information on that. Is there any questions regarding the 3 reports? Okay.
Okay.
Thank you.
Thank you very much. Okay, next up will be the COVID-19 update. Aaron.
You'll go to the first slide for me, Steve. All right, well, good evening, everyone. I'll get started and we'll jump back. So I've got some good news for you this evening. Essentially, all of our trends are moving in the right direction. So instead of this first slide just filling you with numbers that you'll never get to see all of them or analyze all of them quickly enough, I just wanted to give you where we are seeing improvements in some of our key metrics. So green in terms of number of confirmed cases in Cabarrus County. And what I've done there is I've given you the new cases over the last 4 weeks, so you can see a nice decline there from 483 down to 226 for last week. Our hospitalizations are declining, and then our active are also declining. So we have not been in the 600s for months, which is very nice. So we are thankful for the individuals who continue to seek vaccination opportunities and continue their mitigation strategies. Next slide. This is a chart that the state provides to us once a week, and I really like this, number one, because you can see the trend of cases. So each bar shows you the number of cases in Cabarrus County week over week, but it also shows us the age breakdown. And so when you get this, you can take a closer look if you're interested in seeing, where are we seeing a majority of cases. And so we continue to see the most cases in our 25 to 49-year-olds. But you can see, the purple is where our seniors are and our most vulnerable population. And, this last week, a very small number of seniors having active COVID and being confirmed with COVID. So this is a chart that we've looked at for months with our school system leads as we've tracked our numbers with our 0 to 17-year-olds. Next slide. Percent positive is down to 5.9. We got this update today, which is excellent. So we continue to see that drive downwards below that 5% mark. So we're happy with where that came in. Testing remains available. So we have not gotten any concerns from individuals that they are unable to find testing, but we do continue to work with third-party vendors as well as Atrium to ensure that capacity remains available. Next slide. So we were talking about vaccine clinics before the meeting officially started. People ask me all the time, why do you keep those 2 boxes on the left with everything grayed out? Because I think it's important to reflect on where we've been since December, honestly. At some point in time, we will blow these up and we'll celebrate the work that staff have done. But we are winding down our mass vaccination clinic. So this week, we will be doing another vaccine clinic at West Cabarrus High School. We did a vaccine clinic at that site last Friday. And so well received, kind of bringing us back into a more populated area of the county. El Puente continues to be a very popular vaccine site. And I'm going to show you our demographic information in just a minute. Star Med is hosting clinics at Cabarrus, Scotia every Friday and continues to draw a nice crowd there. We will have our last event at the Cabarrus Arena on Friday, May the 14th. This will be a second dose clinic. So we are going to be celebrating our arena friends and their hospitality that they have provided to us. So if anyone would like to drop by between 12 and 2 and give them a thank you, please feel free to. We are so incredibly thankful, and we genuinely could not have done what we've done without that site, the county support, the arena staff that have been there. And then on Saturday, the Cabarrus Brewing Company has invited us to come on site from noon to 8. It'll be a walk-in clinic, so anyone who's out and about would like to come by the brewery for a vaccine, whether they need a first dose or a second dose, we will be there. Next slide. And then this is just showing, we're changing from a passive campaign where people are coming to us, where we're trying to go to where people are. And so these are 2 examples of that. Next slide. So in terms of where we are in Cabarrus County, so 75,566 individuals have been at least partially vaccinated, meaning if they got Pfizer or Moderna, they've at least gotten the first dose. So this is from the state dashboard. We're right at 35% of the population. They do not tease out the individuals who are not eligible, so our 0 to right now are 15-year-olds. And so if you were to do that, that percentage is a little bit higher. Next slide, Steve. And then this is a graphic that you may have seen out on social media and different campaigns. This is, our attempt to share with our community where we are and really the work that we still have to do to get to that goal. The state of North Carolina has put out a goal to vaccinate 2/3 or 66% of eligible adults. And so with either of those goals, we still have a ways to go. Next slide.
Oh, did I ask a question?
Yeah, go back. Go back one slide, Steve.
How are we comparing to the statewide in terms of these numbers?
Well, so the statewide number that you will see in a lot of the press, they are teasing out the 0 to 15-year-olds. So right now, when they say more than half of North Carolinians eligible have been vaccinated, you can't compare our number to theirs. Unfortunately, it's not apples to apples. But if we were to tease that out, we're at about 45%. And I can send you, we track both of those. I wish that they broke down the county level data with those ages teased out as well. In terms of the counties around us, we are in the top 1 or 2 in terms of percentage vaccinated. At one time we were at the bottom in our region, and so with all federal providers and local providers in our region, we're actually in the top several counties in terms of percentage vaccinated. Next slide. So we've talked about this at the last several meetings and focus on equity and wanting to make sure that we've got vaccines for everyone. And I'm really, really proud. We've seen this differentiation really shrink. And so you can see here 16% in terms of vaccinations have gone to our Black or African American community members who represent 20% of our population. So we've got a 4% difference there. And then if you look at the bottom graph, in our Hispanic community, that is 7.8, and so we're looking at about a 3% difference. At one point in time, we were in the 7 and 8% in terms of that difference, and so groups have worked tremendously hard to get out there and to make sure folks had access to vaccines. So if you look, we're actually a bit further apart with our white population now than our minority populations. Our El Puente site will continue to operate for the foreseeable future, and our Barber Scotia partners have invited us to remain on site to continue there as needed. Next slide. Any questions?
Do that one slide.
Go back on slide, sure. And I can send you these
It's hard
slides.
to understand because it couldn't go down in all of them. It was like the Asian and Pacific Islander.
And the Asian and Pacific Islander is interesting. So they represent 5.1 of our population, though it's showing 7.4, if my eyes are seeing that correctly. So it's actually showing that more have been vaccinated than actually. So our plans, just to forecast out what you may be seeing from us, so we are going to bring vaccine work back in-house. We are hiring a couple of key people to be a vaccine strike team, trying to get other staff back to doing their their regular day-to-day jobs, getting back to normal as best we can. And so we'll be hosting in here on Wednesday nights and Friday mornings. Again, there are multiple opportunities for vaccines in Cabarrus County. There's certainly no shortage. But if you have ideas on how to reach groups that have perhaps been reluctant or what we call late adopters, please let us know, because we've got a team that's ready not only to work out of this site, but to go to places.
So I'm trying to connect what I'm seeing here with the 30 to 34%. And it's just graphically, it looks like we're doing pretty good in all communities, and yet we're only at 34%. So something's confusing for me at least.
So I think what the state is trying to show here, so out of the 75,000 total doses that have been given in Cabarrus County, what populations have they gone to?
I see.
Yeah, this is the total of those vaccinated.
Right.
What category do they fall in?
Right, and so are we only running campaigns that are only reaching the white community? And if so, then we need to change that so that our efforts are equally distributed amongst.
So I was in a meeting a little earlier today in which I heard that anecdotally that a community not far from here, the employees in a particular portion of that community were 0 vaccinated, and it turned out that they were all Republican. And if that is the differentiator, then I'm wondering if we need to reach out to folks like Richard Hudson and others and say, how about helping us out here a little bit with your constituents? Is that naive on my part?
I was with Richard last week, and he readily pointed out to me that he was fully vaccinated, and I said, so was I. We both had a mask, taking precautions. He may be receptive to that.
If that's the differentiator, which term was anecdotal in this one community, and there's been some reporting of that nationally as well, then I think we need perhaps perhaps those folks who were readily identified as Republican to make their preferences known and their advice known.
And I will say, this Republican, who doesn't have quite the profile of our congressman, but we did, we videoed second dose and ran it on channel 22 and trying to encourage people to participate. I think anything is worth an effort, worth a try.
Yeah. We recently received some research findings from Duke University. They've done a lot of studies. Both school systems have been a part of some studies, and Marcella will be presenting on some other stuff later, but she could also share a little more. But their findings were two groups really stood out in terms of hesitancy: Republicans and then women. And so we just got that this week. So I believe that's going to help to guide not only some outreach efforts statewide, but also local level.
And it was specifically, they thought women of reproductive age, and so they're a little concerned about, will this affect my fertility? Would it affect, potential?
And then they said so far is that having COVID in young men may affect their
Fertility?
fertility, thank you.
Yeah.
What are we doing about children? I mean, are we doing the outreach for kids 12 and all? I know it's 12 to 15 now, or are we?
So, yeah, that's a great question. So we have been anxiously awaiting yesterday and today to see what both the FDA, and then CDC. So today we learned that the CDC's committee will meet tomorrow. And so we were really hoping that our event tomorrow night at West Cabarrus, we could start. And we actually had some individuals who were scheduled who we called and said it's not looking like they're going to vote on it in time. And so they think that at the state level, but the CDC will come out with their verbal and their written approval, and then NCDHHS will follow to be ready to go on Thursday.
Yeah.
So we're going to miss it by half a day.
I have a 14-year-old friend who's anxious to do her shot.
And I think we're going to see, I've heard more excitement, if you will, from our 12 to 15-year-olds than I have in our 16 and
They're
17-year-olds.
scared, they want the shot.
So,
They also want to get back to normal.
Yeah, they do, they want to make their life.
So how's the Nova Scotia turnout as far as the clinics go?
So, any clinic right now, if we're getting 25 to 30 at that sort of site, we're pleased with. We're done with the days of 1,100 and 1,200 at a first dose clinic. And so, in those sorts of sites, being there consistently and then building that relationship is what's key. And that's why we asked Starman, we need you to commit for a number of weeks to return back. And so it's certainly going well enough that there's stay and people continue coming back. And it's the same thing with El Puente. The first week we had 30 and then the next week we had 60. But again, vaccine is so readily available right now that most people have an opportunity in the multiple locales to receive such vaccine. Thank you.
Dr. Porter with the health director's report.
Yeah, so I'm just going to point out a few of the highlights from the health director's report. In April, we did submit for one grant for the SNAP Ed program for over $700,000, and we received 3 awards totaling $650,000, and that's for bilingual breastfeeding peer support in the WIC program, for emergency dental treatment for children under 5, and then dental prevention and treatment for uninsured adults. Sue alluded to this. We have a number of temps that are working nonstop to get all the billing in for the vaccines that we have provided already. We've currently billed over $800,000, and about $120,000 of that has come in at this point. So, and then they are increasing the amount that they're giving us, so we're hoping that that will help us raise dollars to continue to do good work around COVID and other things. in the clinic service area, in the past month, we've had a surge of hepatitis A cases. The report says 12. I was alerted by Suzanne that we're now up to 15 cases of hepatitis A in the county. Just in the past few weeks, we have looked for any kind of common denominator, and we have not seen that. But we are offering the Hep A vaccine at our syringe exchange program and to high-risk individuals. So we're trying to make sure we're getting folks vaccinated during this little bit of a spread. Medicaid transformation will be getting underway on July 1st, and open enrollment has already started, and we've been working to stay in compliance there so that we're in good shape when everything starts off on July 1st. Erin alluded to, has been talking about a number of things under COVID, and as you know, one of the things that's really nice that now that our rates are dropping is that we've been able to sort of take a breath, step back, and start thinking about what does phase 2 of managing the COVID pandemic look like. So how are we going to, how are we going to staff up and that so we can get folks back to their other jobs? And so it's nice to be kind of moving into that phase and hoping we can keep it that way.
Boyle?
Yeah.
If you don't mind, I see Dan's got his hand raised, and sometimes when you're presenting, it's difficult to see if someone has their hand raised on Teams. So just FYI.
Go ahead, Dan.
Yeah, I just wanted to ask about the hepatitis outbreak. And again, I heard, I guess, more rumor that it was amongst the substance or opioid use disorder patients. Is that true, or is that not panning out?
There are, some of them have been substance users, but they haven't necessarily been, we couldn't find a common connection. If Suzanne is on the line, she may be able to give you the exact number. She's not, okay. But we did look to try to determine, we've been looking at it very carefully to see if we could find sort of like a common source, and have not gotten there yet. Did see that there are some that are substance users, but
Those may be just the ones that got admitted to the hospital. That's just what I heard from the ID doc. So I was just asking.
In environmental health, we continue to have an open food and lodging position. We've been recruiting for that for a number of months now. We have been able to purchase 2 vehicles, which were desperately needed with some of the dollars that we have because of open positions. For Healthy Cabarrus, Senator Newton's office contacted us and asked us to serve as the recipient and then this contractor to work with other entities in the county for the receipt of $260,000 to specifically focus on mental health and substance use efforts. So we've been working on that proposal and plan to be sharing some of those dollars with Amazing Grace Advocacy and a cooperative Christian ministry and Aya House. For our community health needs assessment, it is complete. The document is with the graphic designers, and hopefully we'll have that soon to distribute. Our Walmart grant is be launching June 1st with 3 Cabarrus County daycares, so we're excited to get that going. For our accreditation, FAB has increased their scope of work to include public health clinical services, so that will really align our clinical programs here at CHA more with the FAB process, which will be helpful. With just an update on our proclamation that we signed last September around proclaiming racism as a public health crisis. We've been providing education and training to staff, and we're going to be having a health equity challenge that will launch in June. And we've created 5 subcommittees: community, sustainability, training, data, and policy, to assure that we are both internally and externally advancing there. Our equity coordinator has started. Is he on the line to say that?
I don't think he's on the line.
Okay. We're going to have him come next month, so we can give a little bit of an update on our equity work up till now. One of the updates or highlights I really wanted to spend a few minutes chatting with you all about was the House Bill 558. The Department of Health and Human Services has reached out to all of the local health departments and asked us to contact our legislators demonstrating our opposition to that House bill and to share with you what that particular legislation is that has been put out there. It is an act that will make it unlawful in the state of North Carolina to mandate vaccinations against particular illnesses, including COVID-19. So while this legislation likely put out specifically to assure that COVID vaccine could not be mandated, it is worded in such a way that it could allow no vaccines to be mandated. And so I have contacted, that would really make North Carolina a national outlier, because, you know, all states have legislation that says that some vaccines have got to be provided. So I did reach out to the legislators in our area. I did want to bring that to the board's attention in case you would be interested in also contacting them on you know, to voice any concerns you have about that. That could wreak havoc for school districts, CHIP, you know, colleges, just, you know, if there's just no requirements anymore for vaccines. So we would like to see that legislation.
Do we know if that has come out of committee yet?
It's in the Community Health Committee at this point.
So it hasn't come out of there?
Not that I can tell from the tracking.
I can't tell it from the
That I've been
tracking.
checking.
Does Kristen head up that committee?
No.
She is on the committee, so they specifically reached out to me and said, would you please contact Representative Baker and Sasser since they're on the health committee and really voice our concerns. So I have done that, but I just wanted to get as many voices expressing concern as possible, because that could be a real setback for public health if that would go through.
Dr. Baker has been very responsive to us when we have had issues with bills. Contacting her has been a very good source. She listens, she tries to understand, and she wants to know. So I'll reach back out to her, but I think if we as a group, as a board, did similar, I think we can help that.
And that's all I have.
Thank you very much. And our next presenter is here, and that's Marcella Bain, the Health Cabarrus and Marketing.
Yeah, so I've got a few other staff that are going to present kind of behind me. So I'm going to go over the Healthy Cabarrus strategic plan. So this oversees our community needs assessment process, as well as action plan development with community partners. I think there's 2 slides per page. So within the first strategic plan for Cabarrus Health Alliance, that overarching bucket is that use data to improve health. So we do have a goal within each of those areas. Just scroll down, Steve. So the first goal is to create a community health improvement plan scorecard. I don't know if there's a way to zoom in, I know that's hard to see. So the community health improvement plan are going to be around mental health, housing, and early childhood development and education. And so we will be creating action plans with community partners around each of those 3 spaces. We have already held action planning retreats for both mental health and housing. And then the county has so graciously hired Carla Brown, who is the early childhood coordinator for the county. And her and I and Benfield have got to meet a few times to work on that action plan. And there is an early childhood task force that is a board of the county that I got to join this year. If you'll scroll down. Okay. The next one is the community needs assessment. As Dr. Coyle mentioned a minute ago, that report is done. So my goal is to be able to have that shared with you all next month. It is with Perry Productions to do the graphic design and layout formatting, and then disseminating it out to the community. So not only to community members, but also our local leaders. In the past, I've gone to each of the municipal councils as well as the county commissioners and shared the report with them and the findings and made that information available to them. The next goal is to make strategic decisions and create work environments that foster data integration and sharing and analytics.
So this would align with the state of the county health report. So that is something in the off year. So in 2020, we did the needs assessment. That report is complete. And so then moving forward, each March from here, we will have, so 2022, 2023, and 2024, the state of the county health report, which gives an update on action items since the last needs assessment, as well as provide data to specific health indicators. So things like 10 top leading causes of death in the county and other measures that are identified. The next section is going to be goals around developing internal and external practices and programs. So we do have a goal there under goal 1. So that one is going to look specifically at ensuring equitable access to services, programs, opportunities, and information. If you'll scroll down just a little bit. So we have a CDC Public Health Associate stationed here, currently Cabarrus Health Alliance. So this deliverable falls within, her name is Brooke Narty, and she is working on a chronic disease health equity report. So doing, she's done community kind of key informant interviews, focus group sessions, but looking at a deep dive at the inequities that we see among different racial populations specific to chronic disease. She did a community readiness assessment with our other PHAP, Maddie, to look at how ready our community would be able to mobilize into action to create interventions that are more equitable programs to address health disparities. All right, and then the next one, I think is actually a duplicative one, so if you can scroll, I have terrible vision too. Okay, that's perfect. The next one is increased engagement of community members and stakeholders to participate in the CHIP development. So traditionally in the past, when we develop the community health improvement plan, a lot of times it's stakeholder leaders in different organizations and things like that, or community partners and community experts. But what we really try to move towards, I feel like as an entire organization, is the engagement of the population of focus in the discussions around identification of interventions. So that is something that we've outlined as a deliverable here for both myself and Sandra Torres to do a better job of engaging the population of focus in the development of the action plans, which is the CHIP. The next one is to identify and address the unique needs of the Hispanic population through partnerships and engagement and collaboration. So Sandra Torres, I'm sure many of you have probably heard that name in different regards before, has done an outstanding job really advocating for the Latino community. She serves as the president of El Puente Hispano, the local nonprofit, but she's also been leading these humility sessions with a gentleman from UNC Charlotte and their School of Social Work, specifically looking at the Latino population, understanding cultural humility with that population and really being vulnerable. A lot of our staff have participated, but a lot of local leaders have also participated as well. If you will keep scrolling. The next one is host a social determinants of, sorry, I went too far. So the next area is build and sustain collaborative systems to address social determinants of health. So we have goals under 3 of the different areas. So if you'll scroll down to the first one. So community partners and stakeholders will access the CHIP interventions and strategies to ensure equity and impact of all Cabarrus County residents. So that is really where the forward-facing clear impact scorecard, which I know that language has been used here before, but that public-facing data and repository being a lot more transparent about the action items that we're holding our community partners accountable to and our own organization accountable to make sure that we're tracking that on a regular basis and people can go on and access it at any time. And I will say when we've had the action planning retreat for mental health, the partners there were very excited to be able to have a point to look at all types of data and not have to email 50 people for it. The next one is going to be specific to, and this is something that we started on recently. Maddie and I looked at all department strategic plans that have come before you so far, and we went through it and looked at it from the perspective of were there interventions listed in there that address housing, early childhood education, development, or mental health, and we categorized them. So I'm going to be working with Maddie and then going back to supervisors to see how we can make sure that it aligns with the community health improvement plan. So it's not just something that they have inside their CHA strategic plan, but it's documented for the state as well. The next is to expand and maximize community partnerships to effectively address social determinants of health. So engaging more partners with Healthy Cabarrus on an ongoing basis to improve health outcomes and thinking of non-traditional partners as well. So just making sure that we've got all the right voices at the table to ensure that our plan is more encompassing and comprehensive to impact the community. All right, almost done. Next is to host a social determinants of health training. So Maddie, the other PHAP that I mentioned earlier, and I are going to be working on developing a social determinants of health training to do with Healthy Cabarrus Advisory Board as other community partners, just educating them on how the whole health of an individual is something that we consider, and that things like education and housing and transportation and all those things impact an individual's health. We aren't here just doing health education, but looking far beyond that for individuals in our community. And the last area is transform agency capacity, culture, and practices to achieve excellence. We have goals under 2 of these, goals 1 and 5. So the first, and this is very, if you'll scroll down, Steve, it literally says see objective priority 3. So being a Public Health 3.0, one of the major things that Dr. Boyle has really talked with staff about is being a chief health strategist. And to me, what that definition is what the role of Healthy Cabarrus is to do, is it's engaging partners in discussions about the role that they play in health outside of their traditional job scope. And helping them to see, I had a conversation actually with Asha at Atrium on the way here this evening, and she was talking, we were talking about early childhood education. She's like, no, that's not something we could take on, but how does that impact our employees if we give them a pay increase and then they lose a subsidy for daycare? So those kind of considerations for organizations to look at what they're doing, but also how they can impact the broader community in that space. The next one is to develop training material for the RBA framework. So results-based accountability, I know has been talked about in this group as well. I had an opportunity to be trained through Clear Impact and RBA with the state of North Carolina in CDHHS, and am participating in hosting AHEC trainings. So the Area Health Education Council, I think. But they have one next week, and so I'll be a facilitator for that. But then we already did RBA trainings with all staff. So I believe that is the Healthy Cabarrus strategic plan. Any questions? No, that's a lot, and I talk very fast. So, all right. Well, next up, I'm Melanie Gerfall is right here.
Hello. My name is Melanie Gerfall, and I'm the program coordinator for the Walmart Healthy Food Access Program. Excited to be here today to explain it to you a little bit. So the first priority area, use data to improve health. The first goal, if you can move forward a little bit. Thank you. The first goal there, to create a public-facing data repository to inform the community in its decision-making. To do that, our goal is to complete the scorecard by the end of this fiscal year. And to do that, we are developing the scorecard, identifying population and performance accountability. Next slide. Goal 2, under this priority area, use an equity lens for data collection, analysis, use, and dissemination. We have designed surveys that capture income and socioeconomic status and race and ethnicity demographics. To do that, we consulted with the UNCC research team to add relevant questions to surveys to identify ranges of income status and race and ethnicity options. And we are also planning to disseminate those survey results. Next slide. Goal 3, make strategic decisions and create work environments that foster data integration, sharing, and analysis necessary to support better health outcomes. The first objective, create a formalized process to monitor captured information in surveys and interviews to connect parents with appropriate CHA departments, such as WIC and pediatrics. To do that, we're communicating and educating the Cabarrus Wellness Coalition about the program and any necessary referrals of participants. CabCo is designed to troubleshoot any problems. The early childhood work group is actually the advisory board for this program, so that works out really well. Create a repository of referrals to track participant needs, and if available, provide a final report of referrals to relevant CHA departments. The second objective under this, I think it's actually still the same. Yeah, that's okay. There we go. The second objective under this goal, collaborate with environmental health to ensure quality assurance of food distribution and storage. And to do that, environmental health was involved in the initial grant writing process to ensure feasibility of deliverables and commitment of staff time. A point person has been identified to assist with oversight and ensure deliverables align with environmental health standards. EH will identify and prepare educational materials and presentations on proper food storage and safety. Now we're going to the next slide. Second priority area, develop internal and external practices, programs, and policies that achieve health equity. Goal 1 under that priority area, ensure equitable access to services, programs, opportunities, and information. And so our objective there, adapt programming to ensure all participants are able to utilize services such as payment apps, virtual meeting platforms, and taste tests. To do that, we've already met with each daycare multiple times to ensure that parents have access to virtual meeting platforms in order to purchase meals and participate in evaluation activities. We troubleshoot with our partners and families in the event that there are any barriers to accessing payment apps and virtual meeting platforms. And we facilitate meetings with Meals on Wheels, our caterer, and daycare centers to ensure proper safety measures are in place for these tests. Next priority area. Build and sustain collaborative systems that address social determinants of health. So we're going to focus on 2 goals here. The first goal, expand and maximize community partnerships to effectively address social determinants of health. Our objective there is to establish and foster relationships between Meals on Wheels and daycares beyond the program funding to ensure sustainability based on the success of the pilot program. And our action steps there, we've established MOUs with Meals on Wheels. That's a mouthful. UNCC and daycares. Our next goal, align and integrate public health programs to address social determinants of health. We want to ensure that the Healthy Food Access Program addresses the social determinants of health by serving meals to low-income families facing decision fatigue. To do that, we've determined which centers are appropriate to enroll by analyzing income, race, and ethnicity via census tracts. That was really UNCC. Communicate with daycare directors to ensure participation is desired and feasible. Potentially doing a social determinants of health screening for participants to ensure wraparound services. Next slide. Final priority area, transform agency capacity, culture, and practices to achieve excellence. The goal that we're going to focus on, maintain a culture of quality improvement to advance departmental performance. And our objective there, create a continuous feedback loop between implementation partners and participating families to ensure satisfactory program components. Thank you. Schedule quarterly check-ins. We're actually doing that monthly at this point with daycare centers, our caterer Meals on Wheels, and UNCC to ensure satisfaction. We capture participant feedback via that app website that we're still in the development stage of right now. We gauge partner satisfaction through a survey tool during implementation once we start that, and we update the early childhood work group during the Cabarrus Wellness Coalition meetings on program deliverables. I went as fast as I could. Any questions? Okay, thank you. Turn it over to, I think, Christy or Tracy? Tracy.
So I'm going to present our marketing strategic plan today. So marketing is a little different than everybody else because it's not like a department or a grant or anything. But this is the first year that Cabarrus Athletics has had a marketing department. Marketing provides business insight, helps maintain the company image, make informed decisions, but in order to do that, we have to have an infrastructure in place, which we didn't really have anything. So this year we focused on building our foundation and really making sure that we have everything in place so we can move forward and make really smart decisions. So all of our goals fall under the transform the agency capacity culture practices to achieve excellence, because we're going to be awesome this coming year. Next slide, please. Our very first goal was to create a boss ticketing system to help coordinate the creative, Spanish, translation, print jobs, to help us keep track of those, have one central location. In the past, people would send me things through email, they'd stop on my desk, they'd catch me in the hallway, call me on the phone. It was really hard to keep everything straight. So now we have a boss ticketing system up and running. We're tweaking it a little bit, but it's working pretty good. Everyone's been trained on how to use that thanks to IT. So it was an easy transition, and that is complete. So next slide. Our next one is our Google review. On Google, that's how people look up our business. To help CJ be more competitive, we needed to increase our Google rating. People always want to go to Google to leave a bad review, but really need to be encouraged to go leave their positive experience. So we created cards with little QR codes. We distributed these at the COVID vaccine clinics as a pilot program. We went from a 3.2 to a 4.0, so we're in line with most of our competition. And this coming year, we're going to roll out into other departments. and see how that goes. So that really went well with that. And that puts us in line with our competition, so we can hopefully gain some more patients. Our next objective was to create an all-inclusive marketing budget. We really haven't had a marketing budget up to this point. We have, Marcella and myself have carved out a little niche. But we'd really like to pull monies from all the departments and grades into one big marketing budget that will help us make more informed decisions, use our money wisely, and we just know what's on the table so we can spend to invest in the marketing for CHA. We're slowly getting there. It's still a work in progress, so we pushed it out to June of next year. Next slide, please. Our overall goal would be to create a marketing report with a SWOT analysis and what we've done over the year. So all the foundation that we put into place will hopefully build up to this report. We're slowly putting in controls so we can track marketing decisions and purchases in one central location. But right now, it's sort of spread out through the agency a little bit. People aren't used to having one single place that can help with all those needs. So we've pushed that out another year because we're still building on that foundation a little bit and developing those policies. Next slide. YouTube. We wanted to create a wellness YouTube channel with specific programming with nutrition, wellness, some mental health type things. This was pushed out due to COVID. We have the foundation there, but we really wanted to make sure we rolled this out right because you only get one chance to make a first impression. And we just didn't have the manpower and time to dedicate to making this really successful. So I wanted to push that out so we can make sure that we do the best and we roll that out to the community. Next slide. This one is our marketing training. We wanted to make sure that all employees were on the same page with policies, procedures, and what we have to offer now. I can do the design work, help them create marketing plans for their department or their grant, and just sort of guide them and let them know that I'm here to help take that burden off you because that's my skill set. And we can work together and make a much better product. The marketing training was presented to supervisors in the past. We're tweaking it a little bit, and hopefully by December, all employees will be able to take that, and it'll be included on the onboarding of new employees in the future. That is it. For 2022, we're just going to continue building on the framework, focusing with the departments on their messaging and strategies, and just really trying to tighten up our marketing strategies throughout the agency. Any questions?
I have a quick question. So at the very first of this, you said that we were trying something about our competition.
In regards to the Google score?
The Google score, like if someone looks up like a dentist or something, we want to make sure that our Google rating's right there along with everyone else. Yeah, so when they look us up, that they can, they can best.
I was going.
Yeah, that's it.
Good to be there. Now I got it. Thank you.
Anything else?
Morris, sir. Appreciate the support.
Thanks, Tracy.
Hello, everyone. Hello, virtual and in-person board members. I'm Kristen Klingel-Smith, and I'm the Substance Use Program Manager. So today, what I'm going to go over briefly is our substance use scorecard. And this scorecard is for substance use prevention as well as substance use harm reduction. So that's going to include deliverables for our syringe service program here at CHA. So for data, just like what most people are doing, we're going to complete our harm reduction and prevention scorecard. Not too much to say on that one. When we go to goal 2, using an equity lens, we will be revising our evaluator contract to include disaggregated data based on race. We were fortunate last year to have a grant from the North Carolina Behavioral Health Equity Initiative, and we still have it this year, but it'll be concluding. But they were able to pay for additional analysis of our Cabarrus Youth Substance Use Survey, and that's a survey that's done every year, ideally every year in our schools. We did this year before COVID. But we're gonna be able to have disaggregated data by race to make sure that we can really be specific with the interventions that we are gonna have. Next is annually ensure that participation in focus groups and surveys are related to substance use include diverse samples. You know, sometimes it's easy to go with groups that we are accustomed to working with, like Trail, for example. We've worked numerous years with them, but really getting outside of that and reaching out to different youth groups, youth serving organizations to make sure that we're reaching all populations. So when we're coming up with substance use prevention efforts for youth, that we are keeping all that in mind. And then ensure ongoing efforts to ensure inclusion in our syringe service program. So yearly looking at the demographic background or the demographic breakdown, full reports that are going to break down race, ethnicity, housing status, and gender, just to see if there's any ways that we can reach communities that we're not currently serving. And then for goal number 3, we have a survey called Are You Better Off? And this came out of the results-based accountability that we're doing at Cabarrus Health and Life. I'm sure you all are very familiar with at this point. But we're asking participants of our program, are they better off because we exist? So we ask a variety of questions about, have you used naloxone on someone since you started coming to our program? Have you been tested for HIV and hepatitis C? So we'll want to make sure that we're doing that twice a year, and then use the feedback that we receive on those surveys to make sure that we're enhancing our quality in our syringe service program and making sure we're meeting the needs of the population we serve. We're going to also review the Cabarrus Youth Substance Use Survey. I mentioned that's the one done in schools annually, and propose changes that align with the YRBS and really shorten the survey. It's really long, and there's been reports of survey fatigue from the youth that we work with. So we're going to work to make sure that we have data that can be compared nationally, statewide, and locally, because some of the ways that we ask the questions are not comparable. And then we'll continue participating in the drug-free communities national evaluation, because we're funded through the drug-free communities program. So making sure that those questions are always included. And I've been working really closely with the school system to make some of the provisions for this upcoming survey. All right, for develop internal and external practices, programs, and policies that achieve equity, I have one goal under there. And so my first goal, which I think is really important, is something that I'm trying to spend a lot more time doing, is participating in not just local efforts, but North Carolina, regional, and staying abreast of what's going on from an advocacy standpoint and keeping track of laws that are going to impact the people who we serve, people who use substances. So there's currently a bill, SB 607, it's the Substance Use Disorder Safety Act. So for example, I'm trying to be very active in those conversations to see where that goes, because if that bill is passed, it will make operating a syringe service program nearly impossible with the provisions that are in it. So we'll know on Thursday if that's going to move forward or not.
That's another one we need to reach out and get folks to.
Which one
Yes.
is that? What number was that again?
This is SB 607, and it's called the Substance Use Disorder Safety Act. So they're proposing changes, like our peer support specialist has a criminal background. Well, you would not be able to employ anyone in your syringe service program who has any prior misdemeanors, any felonies, and really the peer support is kind of the heart of the program and how we're really able to make an impact, having that non-judgmental peer-to-peer relationship. You also can't be within 3 miles of a school. Neighborhood associations would have to approve your presence. So we would definitely need a pickle if this went through. But I'm keeping Dr. Coyle abreast of changes that are happening with that. I drafted a letter for review, so hopefully this will not move forward. But there's a lot of bills right now that would impact the substance using population. So just trying to stay abreast of that for our participants. Conduct 4 annual activities to ensure engagement and prevention is accessible to the population at large, not just traditional school settings. In the past, we've had, parent engagement's hard. Parents are busy, they've got a lot of stuff going on. So honestly, COVID's really helped us to branch out and reach out virtually. And there's actually been better attendance and more parent engagement by having those virtual options. So we want to make sure that we're going to continue to provide those options and then find ways that we can reach students that's not through schools, because the schools get asked to do everything. So we want to make sure that we're finding other youth serving agencies that we can partner with to get substance use prevention education out there. Build and sustain collaborative systems that address social determinants of health. We have goal 3. And that's, we plan to increase North Carolina Care 360 usage to 60% to make referrals and track successes. This is something our peer support specialist has already gone through all the trainings, and she's starting to use those referrals where they can. Obviously, the limitation of that is if people aren't on Instant Care 360, then it's hard to make those referrals. And a lot of organizations that this Fringe Service Program refer to are not Medicaid organizations. Or not always Medicaid organizations, they're more community-based. So referrals can be a little sticky where that's concerned still. But our goal is to have not only staff members down there trained in it, but also volunteers when they're down there, so you can make those easy referrals. Also scheduling meet and greets. Our peer support specialist started in February and COVID hit in March. So she was barely through CHA onboarding before everything changed. So we really want her to be able to meet community partners, ideally in person coming up soon, to make sure that we know what a referral process looks like if they're not on Instant Care 360. If they're not on Instant Care 360, encourage them to do so. And then transform agency capacity, culture, and practices to achieve excellent. Goal 2, and I'm nearing the end, I promise. Annually conduct CHA satisfaction survey to maintain a culture of quality improvement, and I'm sure that's something that most departments are including. And then I already talked about the 2 times a year using the RD Better Off survey. And to reduce survey fatigue, what we did the last round in March was we had a few questions that we needed to ask for a grant regarding medication-assisted treatment. So we were able to tack on a couple of those questions to that existing survey, so we weren't constantly giving CHA satisfaction survey or Better Off survey, or is our program working for you? So we try to find ways to be short and sweet and wrap it all up in a bow. That's all I have. Do you all have any questions?
Just curious, if you could, not now, just drop a line real quick about what you have, what problems you have with 607. So if we wanted to respond, we could to our legislators. There's one piece in here that if you're starting a new program, it has to be placed outside of the 3-mile radius of a school zone. I'm not sure in Cabarrus County, unless you went around County, you can find a 3-mile radius of a school zone anywhere in Cabarrus County, south and west of.
In syringe service program, there usually has, most people agree that there's a benefit to it, reducing disease, reducing overdoses, but nobody particularly wants it in their backyard.
Or 800 yards from a residential neighborhood, I mean, right here. If you had one, I mean, the police station's got one, if I'm not mistaken.
Yeah, the projections are that this would close down every syringe exchange program in the state, if this goes through.
This is the 2 that I found. I mean,
Right,
maybe
what Kristen said initially about the peer support, nobody in your program can have a criminal record. You know, how many charges against them. That, because again, a peer, you want to hire a peer support person, they will often have a record. It might be from 15, 20 years ago, they're totally rehabilitated, they're fine, upstanding citizens, but now that would exclude you from being able to.
Now, is there more than one syringe exchange program in Cabarrus County?
We did have an alternate location at Trinity United Church of Christ on Church Street. When COVID got kind of to its peak, we decided to pull back at that location temporarily because it was not conducive to social distancing whatsoever. And actually, I had a discussion with the pastor a couple weeks ago, and we decided to terminate that location indefinitely, just because we never had a huge, for some reason, well, it is right down the street from the sheriff's office. So there was that barrier. But that little hiccup.
I was sitting over there, it's not an exchange, it's a drop-off.
Drop.
It's a drop-off, my bad. That's my mistake. I just need, whatever your concerns are, I'd like to know, so that way we can reach out.
Yeah. Share that. I can also share the template for House Bill 558.
I already emailed her on that.
Okay, thank you.
I could find about 20 in there, so it was easy.
Yeah.
And I know that the North Carolina
Do that.
AIDS Association has reached out to Kristen Baker and provided education and talked about some of the successes that our program locally has had. And the letter that we drafted has an outline of, what we've accomplished since we've been
Just
in
send that
this.
to us and forward from us or whatever.
Sounds good. Well, this has been fun.
All right, thank you, Chris.
Thank you. Have a good day.
All right.
Or night.
So 607 is a Senate bill. So
Yeah.
Baker will only be able to react if it gets to the House, and then it will already have come out of committee in the Senate. So Newton would be a resource, a quicker resource to actually impact the bill, in my opinion, because it's going to come out of committee in the Senate side, not on the House side.
I'm happy to provide all the information and your assistance. We greatly appreciate it. Thank you all.
Are we responding as a board to some of these things as well? Where we have issues, or is it better to come one by one as board members? I'm kind of curious
That's
about.
worth some discussion, because that's why I'm starting to try to bring up these policies and that, like, how do we, as, I mean, I think some of this legislation would be very helpful as a board if we, I can do it as a helper, but I'd love to see something come from the board, saying the entire board is contacting you. I think sometimes they, Chip, you seem like you've got a really good grab on policy here, so jump in if I'm not saying this, but I think they tend to look at the numbers of, that they get. So if each of you went in individually, then we'd have 9 personal, individual responses versus one coming from the board. Do you have thoughts on which way you get more?
I think it helps if there's numbers, but I also think it helps if there's credibility. If Dr. Baker knows you or knows of you and can say, well, the director of NCRC has a policy issue with this, and here's why. That carries a lot of weight. But as a board, and I'm trying to get our board a lot to intervene, and usually they do it with a phone call, an individual phone call or an individual text message or whatever. But Dr. Baker has been phenomenally responsive. She wants to understand the legislation. She wants to make sure it's right. She wants to do right by the community. And she represents literally the piece of property we sit in.
I think to the extent that you can provide us either with a document that we can put into an email or into a post, I tend to think you're right, that the volume is important. But I'm also wondering if, and I'm a bit of a novice at this, you guys probably have a better sense, but if we limit ourselves to our own representatives, it makes sense to go person by person because they know most of us. But I'm wondering, do we go out to others that are not our local representatives and maybe then go as a board?
I think what helps there sometimes is that if you read the sponsors and you know whether or not they're from Lincoln County, Rowan County, Stanley County, whatever, Cabarrus or wherever, that you can get a better response from somebody who's regionally located versus if I went to, somebody in Watauga County, I'm probably not going to get a response from that. But, from a regional standpoint, especially the bigger bills, and then if you look at that and can know who's on the committees, and if there's a sponsor of the bill that's going to be on the health committee on health, then you know that bill stands a better chance of getting through that committee than it does others.
Yeah, I don't mean to add to your workload, but.
No, I'll gladly get those out to you.
The thing that adds to the workload is getting a bill like that passed. So the workload on the front side is 90% of the time, and what I've found out is that when we're dealing with school bills, is that if you do the work on the front side and at least try to get the bill modified or to where you can, I spoke with Commissioner Morris 2 weeks ago. The next day I was on the phone with Dr. Baker and I said, I spoke with the
Mr. Morris the day before, and he wants no part of this particular bill that would impact his work. I said, I can't speak for him, you're more than welcome to talk to him, but that's almost exactly the words he used. And the next 2 days later, the bill didn't come out of committee, he's gone back to the writers, it's gonna be changed and modified to be less restrictive than what we had talked about that bill. So those things can happen, but you gotta, just a shame we gotta sit here and look for these things, but we gotta sit here and look for these things. Because the work on the backside of 558 is enormous. The work on the backside of 607 doesn't exist. So do you want those exchange programs to go away?
Does the Department of Health and Human Services provide any guidance on this to local health departments?
They have, the NCALHD, North Carolina Association of Local Health Directors, just hired a new executive director in the past couple of months, Katie Griffin. She's a lawyer and she is really focusing on policy issues. And so they started, the DHHS has started sending out a weekly policy brief. Here's everything that could have some impact. And then they really do a push into something that we feel like, whoa, this is really a hit to public health, which is these two bills. So they have really started focusing on it. Just since I've been here, it was the first couple of months I was here, they weren't. And then I think since Kate Griffin started, she's really advocating that we do more. So I'll continue to bring that to the meetings, the updates, anything we should know about, and then ask you to reach out. I do think the immunization one is critical to get some words, get opposition going, because that will really, that's a game changer when that is. How do you change that on the back end?
So in the real world, we've almost eliminated polio. Okay? Just about eliminated.
Yeah.
What 558 does is put us right back in the game of having to fight polio. We haven't had a polio outbreak in America since the 60s.
Yeah.
I mean, how far back do we want to shove the state of North Carolina?
Measles, mumps, rubella.
Go with any of them, but I go back to
We'll go back
polio
to the, yeah.
because it's ridiculous that we're sitting here with a bill in Raleigh that would literally take us back to the point where we could not require polio vaccinations. How in the world can we not get behind that?
The good news that Commissioner Morris has shared with me is that the person who has brought that bill forward has very little credibility in Raleigh.
Okay.
Right.
I was going to say, I hope you don't suffer a lot of personal consternation because it's one of your Cabarrus County representatives that has introduced the bill.
Legislator Pittman has introduced the bill.
Okay.
I was trying to say that a while ago without going directly.
Just cut to the chase.
Knowing who introduces it, who's the primary sponsor,
Okay.
who are the sub-sponsors,
Well,
is really important.
Yeah.
So you give us some information so we can do
Yeah.
that we need to do. Okay. We'll move to you, Sue.
Okay, so next on the agenda, not as exciting, but your budget revisions for the month of May. The largest that we have is the additional COVID funding that we are receiving in, so that's increasing our budget a little over $200,000. I believe next month that we will continue to have quite a few budget revisions along the Medicaid cost settlement, COVID dollars, and wrapping up our budget year. Are there any questions regarding the budget revisions?
Does the amount, like it's number 6, 217,000 fund?
Yes.
Does that cover our costs?
Currently, all of our COVID funding is covering our costs, thanks to contributions through Cabarrus County government. They have given us money in the beginning of the year as well as December. The state agreement funds have came in. The billing is starting to come in, and that is extremely helpful. Whenever we were asking for funds and planning the year, didn't know when it was coming in, how much was coming in, and what all it will be. So those will be funds available to us if we don't need them for expenses this year to continue our efforts next year.
Questions? Okay, may I have a motion to accept the budget revision?
So moved.
Thank you, Chip. May I have a second?
Second.
Okay, and that was also Steve. So maybe, all in favor, now go through the list. Chris Bo,
Aye.
Dr. Taylor,
Aye.
Dr. Haber,
Aye.
and those present in the room?
Aye.
Thank you very much. Motion carried. Okay.
Next on your agenda is the finance purchasing policy. These policies are brought to you once a year for your review. This year, we are changing the minimum amount for a bid from $5,000 to $7,500. That is in line with the government's along with many Brooks requirement that we have to follow. So we are increasing that, and hopefully that will help our program managers in our purchasing department and things like that with the things that we need for that. Are there any questions with the finance policy?
Okay. No questions with that, so now I have a motion to accept the finance policy.
So moved.
Okay, thank you very much, Mark. May I get a second?
Okay.
Second.
Okay, thank you, Dr. Pons. All in favor, I'll read the list again. Chris Bo,
Yes, sir. Aye.
Dr. Taylor,
Aye.
Dr. Hagler,
Aye.
and those in the room? Aye. So thank you very much. Motion carried. Next will be the preliminary budget.
The preliminary budget, thanks for your review. It does not need a vote this month, but will need a vote in June, whenever I bring the final budget. Please feel free to review this, look over it, and if you have any questions after the meeting, to let me know, and I can bring the meeting. Our budget for next year is approximately $24 million. Our request from the county is just a little over $9 million. The increase for the county is for our school health program and an epidemiologist, as well as additional environmental health personnel. We presented that to our county commissioners on April the 15th and are awaiting their final, which of our items will be funded. But I believe it was a very positive meeting. The fund balance appropriation for next fiscal year consists of our portion of the school health increase hours that we had a commitment to for the county a few years ago, where it's a stair step where they're taking over that a little bit more to increase our hours and their benefits. Information technology, always replacing hardware, software, those kind of things, so that as well. Our clinical services, we are working diligently every year. However, the maternal health, there's not a lot of money for that. And we also are going to have an increase in our dental revenue, and our projections for next year is that program continues to get on track. We have budgeted for next year $1.4 million for our Medicaid cost settlement. In 2018, we got 1.4. 1.6 in 2019, and 1.8 in 2020. And we are awaiting our final numbers for this year, and this year 1.2 is budgeted. However, based on preliminary numbers, it's going to come in higher than that. So our performance awards for our employees is budgeted at 3% of an increase. That will be an average based on performance. That scale will come out soon. We were very fortunate that our health insurance plan this year did not go up, and it's the same. Our state retirement rate did increase to 11.3% from 10.2. We do have equipment items in the dental program, and I believe as next year continues in the revenues command that we will have additional equipment replacement items to bring in throughout next year.
So retirement match is 11.3. The retirement match is 11.3.
Yeah. And then after that, all the additional, Steve, if you'll go to the next slide, it kind of gives a few more numbers. Next one. That is an overview from the next couple of years, and then after that is likely some detail that you may want to look at on your own. Our CD department revenues and expenses are up next year, and of course that's from response. And the public health solutions is up, and we have been awarded a grant next year for that one as well. Are there any additional questions at this time regarding the preliminary budget? No, you don't need to vote on it. It's for your review. We'll vote on it in June and I will start making adjustments. We've gotten in some additional information about our WIC program, so those numbers will change just a little bit. And I'll work on that, get it as close as we can, and continue to work with the county to find out our funding.
I just want to add one thing.
Yes.
Between Cabarrus County Schools and the city schools, being in all the meetings we've been in, if we did not have our school health program that we have, that county commissioners and Cabarrus County residents have supported for years, this year, in the past 12 months, with the pandemic the way we have, we would not have been able to have school in many cases. So it's a jobs only outside with parents that nobody's going to be able to count. It's saved opportunity cost at an enormous rate. So the money that gets spent in that program does more than just take temperatures and put Band-Aids on the scrapes on the playground. And this year was evidence of that, and we could not have functioned the way we did function with the number of kids we've been able to put in schools without that program.
Thank you for commenting, because I think our board is very proud and very committed.
You raise an interesting question though, because their reach is beyond taking temperatures and putting Band-Aids on scrapes. Are they correctly school nurses?
Absolutely. I mean, from what I can tell, yes. When you talk across the state to other communities that do not have what we've been fortunate enough to have, I mean, there's superintendents all over the place. There's going to county commissioners this year saying we need more, we need a school nurse or we need more school nurses, because there's counties across the state that are not as fortunate as.
No, I'm not questioning that. I guess what I'm saying is, and I won't get this right, but are these folks actually school health coordinators? Are they something that takes them into a realm by title of a broader responsibility?
I would defer to Dr. Cole, but I would say that nearly everybody who works in the school is a counselor, is a nurse, is a teacher, is a whatever, is called on for that. They absolutely do social work, they absolutely do teach, they absolutely do nursing.
It's an interesting point, Mark. I like it because it's going in the direction that I think it's really important that we go in, because people think of school nurses and they think of somebody who's sitting in an office, you know, checking temperatures and handing out Band-Aids, but school become so much more comprehensive and public health oriented in terms of thinking about, supporting school gardens and, what are we gonna do about all the mental health issues? And so they're really having to take that more global perspective, and people still think of it as it's just that person sitting in an office, handing out aspirin.
Yeah, as I think about public health 3.0, begins to suggest a different, and titles be what they may, I guess the role itself, a title for me becomes dysfunctional when it doesn't describe what they're doing.
I think to some degree, I'd have to look this up, and maybe Erin will know more since she's been in the state long. I'm guessing that the way the state mandates school nurses and that it might be hard to change the title. I just have to double check to make sure it wouldn't potentially mess things up there.
I think it's also the important for a parent to understand what that person does. And
Yeah.
people know what nurses do. A school health coordinator, what does that look like?
Yeah.
What do they do? The school, when you talk to a parent, you say, well, we got a school nurse, that immediately they know what they should expect from that position.
So the user population understands.
Right. We, education tends to complicate that in many regards.
All right, our next agenda item is the nepotism policy. I think we visited this in the last board meeting and we tabled it and kept. Sorry, I guess you're back up again.
Yeah, I am, I'm trying to get to it.
While you're looking for that, I just had a quick question. Is there, when it comes to approving the budget, do we have to have a public hearing?
I think that's what, I believe the reason why we present it tonight and we don't approve it till next month is so that folks can comment.
And we will receive our budget next Monday, and then we will set a public hearing, and of course that will trickle down, so I'm not sure how that timing wise.
It's page 118.
We'll have our public hearing set for June.
Oh, we also, in addition to that, are required to announce something, at some public vehicle, a public hearing.
I do not believe so. We don't.
Just asking the question.
We did last year, my first year here, so.
But you do have an option for public comment at every meeting.
Okay. All right, so this is the revision, and if I remember correctly, there were just a couple of things that the board wanted to take a look at. So the term supervisor was removed. The term supervisor was removed, and now it's a senior subordinate relationship with what we replaced with that. And it's also some of the terminology changed from relative to related party. This looks a little longer than it was last time, but it's really not. Because the longest piece is, after speaking to the attorneys, they wanted to add in, spell out who a related party is, which I thought was a good idea. Anyway, when I first looked at the policy, I said, well, it doesn't spell out who it is, so wanted to spell out who it is, change some of the language from supervisor to senior subordinate, and change relative to related parties, that's related by blood, marriage, and any variation of such. So all the things that the board suggested were addressed, went to the attorney, and the two big language pieces that were discussed were changed.
And it still gives Dr. Cole last right.
Yes. Yes. And I think it addresses what was mentioned last time. Part of this is to help fill some of those hard to fill positions dental assistants. School nurses. Some of them, so.
Any questions from the board? I know there were a few questions last time, but does this mean satisfaction for? Okay. I think Dr. Hagler had some questions before. Any questions at this point in time, Dr. Hagler?
No, I know having to lawyer this up makes it pretty wordy, but I think that was smart, so I'm good with this.
All right, if no further questions, may I get a motion to accept the nepotism policy?
So,
And I get a second? Chip's giving a second, so again, all in favor, I'll read the list. Chris Bowe?
Aye.
Dr. Hagler?
Aye.
Taylor?
Aye.
And the people present in the room? Aye. So thank you very much, and the motion carries, and thank you very much, CabCo, for getting that reviewed and taking care of for us. Okay, no problem. Our next item on the agenda would be informal public comment, so I'll open up the floor at this point in time.
Not public, but as a board member, but did want to mention that, and I think that Health Alliance staff is aware of the fact that Cabarrus County has significant funds available to assist with rent and eviction for folks in bad situations or folks that need help. And so we want to get the word out and make sure that that folks that need that assistance are aware that it is available to them. And there is, through our Department of Human Services, an application process that we encourage people to participate in. That also applies to landlords.
Thank you very much.
Do you have, a document that summarizes this and where our staff could refer folks so that I can share that out?
Absolutely, we can give that to you.
is that being run with the CCMs?
They are aware of it. Yeah.
Thank you very much for that announcement. And again, we'll close the floor at this point in time. And I guess the only other item would be just general announcements. And again, I won't necessarily have an announcement, just a follow-up question in reference to the Board of Representatives. Have they been sent over to the county commission? So again, we'll know that everything's in line. We'll make sure that. Okay, if nothing further, then again, I would like to ask our Vice Chair if she would make a motion for us to go into closed session.
Motion to enter into closed session pursuant to North Carolina General Statute 143-318.11A1 to prevent the disclosure of information that is confidential pursuant to North Carolina law.
Can I get a second? Second. All in favor, I go down the list. Chris Bowe.
Aye.
Dr. Hagler.
Aye.
Taylor.
Aye.
All in the room.
Aye.
Thank you very much. We will now go into closed session. Okay. Thank you very much. We're back into regular session of our board meeting, and may I have a motion at this point in time to close our board meeting?
So,
Okay, and a second, we'll be here with Dr. Pons. All in favor, Chris Bowe? Okay, and Dr. Hagler?
Aye.
And Dr. Taylor?
Aye.
The rest in the room?
Aye.
And we are now adjourned. Thank you very much, and we will see you on June the 8th.